Hello, everyone, and welcome to today's webinar. My name is TJ Anderson. I lead our coaching and practitioner portal here at Heads Up. And today we are talking all about the power of remote lifestyle data in 2020 and beyond. The 3 secrets to differentiate your practice, boost client engagement, and optimize outcomes with ease. And today I also have a special guest joining us for the first part of today's webinar, actually our Chief Medical Officer, Dr. John Lemansky. So John's been a great fan of ours, and so much so that he actually joined the team. So here's a couple testimonials to kind of give you an idea of how other health experts in the world are using Heads Up and why they are using Heads Up. So I want to first welcome John to the call. John, thanks for being with us here today.
Yeah, of course. Thank you, TJ. Thank you to everybody who's joining us today.
Yeah, we got people all over the world, Sweden, Dubai, of course, the States. So tell us a little bit about, real quick, John, about your work in the world, your practice, and why has Heads Up been such a great game changer for you and your practice?
Yeah, of course. So as TJ mentioned, I'm the Chief Medical Officer, and I've been with the company now for about 3 years. And actually, I first started as a client because when I first started my practice, I was initially hospital-based, so I was a hospitalist for many years. And I started working with individual clients on the side, doing kind of preventative health, wellness, medicine. A lot of my stuff was virtual, but also I would see people in person. And so I was very used to like the electronic medical record system from working in the hospitals, and I'd used many different types. And I looked at some kind of other competitors out there, but there was nobody who was really doing what I needed. And in my scope of practice, I use a lot of data points from different tools that are out there. So things like Oura Ring, Whoop, lab results. And it became really tedious to try to track every patient's data points on an Excel spreadsheet. And not to date myself, but I'm older than most people probably on this call. And I hated Excel growing up. And so it was kind of like, karma that I had to all of a sudden become an expert in it. And so I found myself wasting so much time, probably spending more time charting, trying to get the data points, trying to make sense of the data points. And one of the reasons that I wanted to leave traditional medicine and hospital medicine is because I spent most of my time, the majority of my time, actually just charting and just making sure that everything that I put into it was enough to bill for a certain code. And so in a typical like interaction with the patient, it would be like 5 minutes with the patient, 30 minutes documenting. And so I found myself basically doing the same thing, and I was getting frustrated. So luckily I met Dave, who's the founder, at a conference, and I was presenting on my topic, and then he was presenting after me, and I was just blown away with what he had created. And that was a couple of years back where the product wasn't anywhere near what it is today. But I initially signed up and started conversing with Dave and giving him feedback in terms of what I would need from the platform, and maybe just giving him some pointers. And we've really kind of worked together, and now with TJ and the rest of the crew, to come up with a product that's really geared towards, practitioners. So initially, the kind of focus was on individual clients, and we still do that. But I felt that there was a really good ability for us to be a leader in a space where practitioners could use the platform specifically for what I was doing and for what I think a lot of other people are going to do. And now with a lot of people going virtually, it seems to be a very good platform for people to be able to track data. And I'm sure most people on the call are like myself, where time is very valuable. And so I've found that with Heads Up Health, the dashboard and the platform, it saves me so much time. Once it's all integrated and patients are signed up and they're able to enter their data, for me, it's really simplified my job. And so I was able to go back to what I initially wanted to do, which was to spend most of my time with the patients, and then very little time really being able to track the data. and focusing on the data points that I wanted. And so it's been a really good experience, and I think we've created something that can be very useful for a lot of people.
Thanks, John, for the context there. And of course, thank you for the introduction and context around your work in the world. And everyone has a different benefit and a reason why they really love Heads Up. And as you said, it really saved you lots of time, help you streamline the practice, bring all the data in one place. And so as John mentioned, again, if you have any questions for John, he's our Chief Medical Officer, uses this in practice. Please put those in the chat box. John might hang out for the next 10 or 15 minutes, and he can maybe answer some questions.
Absolutely.
Otherwise, we'll go ahead and get started here. So today, the power of remote lifestyle data in 2020 and beyond. As we all know, the world has changed quite a bit over the last 8 months or so. And so today we're going to really a chance for us all to come together and learn and stay on the cutting edge. And so our intention is to share what we've seen as a leading health data analytics platform on the cutting edge around what the top secrets are for practices in terms of differentiating themselves, improving engagement, and of course, outcomes. That's what we're all about here. Now, I just want to do a quick disclaimer. I want to pause and take a second to stop just to let you know. This webinar today for the next 50 minutes, this is only for health professionals, coaches, doctors, other patient-facing health professionals who want these 4 things, okay? And if, number 1, you want to save time by organizing all of your clients' health data in one place. Number 2, you want to remotely monitor your clients' health data from anywhere in the world. Number 3, you want to motivate your clients to take sustainable, data-driven action in their lifestyle. Number 4, you want to be able to validate your programs and protocols with the power of data, and then maybe even use that data in your marketing to help you attract more patients, more clients. So those are the kind of 4 pre-qualifiers. We want to make sure this is a fit. So you don't need to stay on for the whole webinar if you do not resonate with these 4 areas. But if you do, please go ahead and stay a while. And if you stay to the end, we'll have a special, exciting opportunity for you to get involved as one of our last early adopter members of our Founders Club. So as a reminder for you all that might be saying, all right, who is Heads Up again? What are you all about? So we are a health data analytics and remote monitoring platform specifically for root cause health professionals who want to leverage the power of data to save time, attract more clients, and optimize outcomes. And basically, we're leading the data-driven healthcare revolution, which there's lots of leaders, there's lots of different players doing different work in this space. And we believe we're pretty innovative and we're on the cutting edge and really shine in a lot of areas that a lot of platforms don't. And so throughout today's presentation, if you have any questions as we go, please don't hesitate to use the chat box. We're also going to be asking you questions to engage with you all. So this is intended to be a dynamic experience here together. So with that being said, today, this is what we plan to cover. All right, so number 1, we'll fulfill on our talk title, and we'll share with you the 3 key secrets to differentiate your practice, boost engagement, and optimize those outcomes. Number 2, we're going to share a simple formula for you. We call it the OAO formula that you can use to become a data-driven health professional in your practice. And if you're already a data-driven health professional, you can elevate that game to the next level. Number 3, we'll even give you a sneak peek tour of our Heads Up Health system, showing you the ins and outs real quick of how it works from the individual's perspective, as well as the health professional's perspective. Plus, as I said earlier, if you stay till the end, you can learn about how you can get your first month free with us and be one of our last members of our Founders Club community. All throughout September, we are opening up the doors for one last call. We have 20 spots left in our early adopter Founders Club community of our first 100 data-driven health professionals. And then to end, we'll have Q&A. You can ask us anything. We're here to support you with improving how you position your practice and use data in your practice overall. So for a quick refresher on us, so now that that's an overview of what we're going to cover today, quick refresher. So we actually started direct to consumer. So we have a consumer solution. The individual can join on their own. It's $10 a month, and we integrate both medical data and lifestyle data for a complete picture of health. So I actually had the honor to interview our CEO and founder on my podcast last year. I interviewed Dave Korsunsky, and he described the direct-to-consumer solution as an electronic health record for the individual. And like John, I fell in love with it personally and also started using it in my own practice. So I had a coaching practice and still use this a little bit with a few clients here today. And I fell in love with it and started using it in practice, and clients were seeing great results. And then Dave decided he would convince me to join the team. So in January of this year, I joined the team. And for context, we have 30,000 members in over 60 countries all across the world. And we've been around since 2016. And in January of this year, earlier in 2020, right before the pandemic hit, the Health Professional Solution launched, giving coaches, doctors, other patient-facing health professionals unprecedented access to their clients' data, real-time lifestyle data, vital signs, clinical data, all in the same place to help you personalize your protocols, using data to validate your programs and protocols, running progress reports on your clients, and of course, ultimately allowing that to achieve better outcomes. So as I mentioned, the opportunity to get involved with us at the end of our presentation today, I will share more details about our Founders Club. So the Founders Club is our early adopter community. We will be closing it once we get to 100 health professionals at the end of this month. We have 20 spots left. So I'll explain all of that, how that works. You can lock in early pricing, be a part of our monthly mastermind that John and I co-lead each month. So stay on to the end and we'll get into that opportunity. So let's take a step back here for a second. All right, let's ask ourselves, what are some industry trends that we've seen happening in 2020 so far? Of course, the pandemic hit, people are closing their doors of their business. And these 4 points here, these are actually articles that we have found. And, it's our job to stay on the cutting edge in this health technology space. And so a lot of these questions, a lot of these opportunities that are coming up now in 2020 are a chance for us to respond and improve our approach as practice owners, coaches, doctors, nutritionists, trainers, you name it. Whatever role you fill, whatever health professional focus you have, there's an opportunity for us to evolve. And so we'll just go over these a little bit. Will COVID-19 pandemic accelerate patient access to data? Really core question right there. How can smartwatches transform the healthcare industry? Remote patient monitoring updates, developments, and opportunities for physicians. And could the pandemic lead to a boom in medical technology innovation? I think the answer to a lot of these is yes, yes, and yes. So I'd love to hear from you if you want to put in the chat box a little bit more about what you've seen maybe on the trends and maybe how you've responded with some of these trends in your practice. And so I think we can all agree that we're kind of being forced to evolve. We're being forced to change our approach. And with these trends happening in 2020, our job is to support practitioners with actually being able to use this data, the power of remote lifestyle data, to improve their practice and to improve outcomes. So we'd love to now stop and pause and ask this question. We'd love to hear from you. So please use that chat box and tell us a little bit about your practice and how you currently use data. And some questions to kind of get your wheels spinning. Number one, how do you differentiate your practice currently? That's a big area of opportunity, is differentiating your practice to attract your ideal target market client or patient. Number two, how do you position your overall offerings? And number three, how well do you currently infuse the power of data into your solutions? Go ahead and reflect on those three questions. Tell us a little bit about your practice and how you're currently using data inside of your practice and how you position your practice and your offerings. Go ahead and use that chat box. Let us know. Excited to hear from you all. Awesome. We got some new people joining already. Again, we're pausing here to reflect on where you're currently at in your practice. Tell us, how do you differentiate your practice? How do you position your offerings? And how are you currently using data? Awesome. Looks like Anne Marie says she wants to track progress in reversing HTN, obesity, diabetes, circulation, and inflammatory disease with lifestyle medicine. Love it. Especially optimizing intakes of certain whole foods and avoiding processed foods. Love that. Cool. Go ahead and let's keep the comments going as you guys reflect on this. How are you currently going about positioning your practice? How are you using data? And take your time on this. I'm going to go ahead and keep moving forward here, but I'd love to learn from you all to hear how you're currently doing it in your practice. So we'll see more comments flow through. Now we're going to get into those top 3 secrets that you guys are waiting for. Okay. So secret number 1, it starts with positioning. So the question becomes, what is your target market client? How well are you attracting this ideal market client, and how do you position your offerings? And here are our top tips for you, especially when considering to use a system like ours, a tool, an app to help really use data in your practice. So number one quick pro tip is to give your patients a free trial of Heads Up. Our system, as a member with us, your membership gets a certain amount of clients. Depending on what level of membership you start, you cover the cost of your clients. They're not hit with a paywall. And because of that, we suggest you actually use our system as a lead generation tool. You can provide a free trial, maybe a 7-day, 10-day, 14-day free trial of our Heads Up Health system, where your patients, your clients can download the app, start using it, start adding and connecting their data, and self-managing and getting used to the tool. So it's amazing value add that you can dangle that free trial out as a lead gen tool. So number 2, for paying clients who are already a client or a patient, we suggest you record a video overview, maybe about your practice overall, maybe about your offerings, but also specifically welcoming them to Heads Up and maybe giving them a quick tour of our system, maybe showing them how they can use it, maybe the 80/20, nothing too big, maybe a 5-minute video showing them how to add data. And we'll give you a taste of the demo in a second, right? So you can have a better feel for it. Number 3, overall, just personalize your approach. The more you can personalize your approach in your practice, the more your patients, the more your clients will feel taken care of. Number 4, ultimately, it comes down to positioning inside of your offerings, and you can position our system as a bonus and as a value add to attract more clients overall, especially clients who want to take their health into their own hands, those that might already be a little bit more motivated. Plus, as a bonus, inside of your goal for positioning your practice, we can support you, if you're a member with us, with written copy, video messaging, and other assets that you can use and deploy when wanting to communicate to your clients about what Heads Up is all about. So you can add those to your web page, landing pages, program overview, you name it. So secret number 1 for using a cutting edge health technology, health data tracking platform like ours, it starts with positioning. If you want to differentiate your practice, it starts with positioning your offerings and positioning our system as a bonus and a value add. Our goal is not to be another expense of yours. It's to truly be an ROI. Awesome. Yeah, John, thanks for the comment. So great point. Using a free trial with potential clients is a great way to show the benefit of using real-time feedback for behavioral changes. Exactly. And that's a great point. You know, what good is good data if it doesn't lead to better outcomes and sustainable behavior change? So that's what we're all about. Secret number 2, connect the data with their goals. Okay, so if you're working with patients or clients, the question becomes, what data are you tracking in your practice already? And how can you help your clients make the connection between their data and their goals? As a coach, this has been a big eye-opener for me over this last year as our access to data has grown with advanced wearables and devices and apps. It can get really overwhelming and confusing around like, oh, wow, there's so much data to focus on. Where do I start and it's like a fire hydrant of data and information. So our goal with you is to really support you on being really mindful about the data you focus on tracking, as well as making that connection between how the data impacts their goals. So really it comes down to choosing the most important metrics to measure in your practice. Lifestyle data and clinical data. They're both interrelated. They can affect each other. So that's pro tip number one. Number two, a part of our onboarding process for all of our Health Pro members, we actually customize your entire system, the platform, and specifically the lifestyle dashboard. So if you've already seen that, a lot of you have already seen that, but we have actually over 60 different data points. This spreadsheet here highlights the 60 plus data points that we offer from sleep, movement, nutrition, body composition, behavior change, macronutrient data, metabolic health, as well as some advanced biohacking tiles. So there's lots of opportunities in terms of choosing what data you want your clients to track. And our suggestion is to choose 10 to 15 data points, which we call tiles, on your lifestyle dashboard. And this is also what's on our mobile app, by the way. If you haven't downloaded our mobile app to play around with it, feel free. But the 10 to 15 data points allows you to give a little bit of focus and trajectory around where your clients should be focused on, like with their data, what data to measure and how to go about keeping your clients focused. Otherwise, they can get really overwhelmed. So sleep, recovery, movement, as I already mentioned, I showed you that spreadsheet there. That's a part of our onboarding process for all of our practices. And then, as I mentioned earlier, find ways to connect data to their goals. So what goals might they have in their health overall? And how can you connect those with data points, whether it's body composition, like weight loss or body fat, or maybe sleep data, recovery data, movement, nutrition. There's lots of different lifestyle data points that you can set up as goals for your clients that can keep them engaged, not just every time you see them, like once a quarter or once a year, but literally on a daily and a weekly basis. Our system is designed to make it easy for your clients and patients to self-manage and self-coach and self-track their own habits, their own lifestyle behaviors. So that's secret number. Yes, go ahead, John.
Sorry, can I just jump in for 1 second?
Sure thing.
Yeah, and I think this is a really important point because going forward, data tracking, I mean, you're seeing Amazon getting into it, Apple's heavily into data tracking, Aura just partnership with the UFC. So I think clients are going to be coming to you and wanting to have this data available for you to follow. And so instead of going back to that spreadsheet that you showed that brought me back to the good old days,
yeah.
Within Heads Up Health, you're going to have the ability to have tiles to basically monitor the data points that people are going to want. So it's very important to be on the cutting edge, especially with a lot of the clients that you might be going after who may have all these data points of these devices and want to be able to share it with you.
Great point. Exactly. You know, you're highlighting those other trends that are already happening with a lot of our partners like Oura Ring, for instance. And so the clients are wanting to stay on the cutting edge and they're wanting to be guided, right, in the simplest way possible. So for us as health professionals, we have an opportunity and almost a responsibility to properly guide them. So that's why it's so important to connect the data with their goals. And eventually our whole system will be self-service. So you can design, and it already is to a certain extent, you can customize the dashboard for each individual client. We'll show you that during the demo. Secret number 3, infuse it into your practice. Okay, so when using a tool like ours, the more you're able to infuse the use of Heads Up into your practice, your day-to-day practice, the more it's a part of your offerings and the more your clients and patients can get used to the fact that this is going to be a platform and a system that like is core to their work with you, right? And because we're co-creating health together and requires both the individual and the practitioner. And this system, the more you can infuse it in your practice. So here are a couple tips. So number 1, yes, you can come up with 10 to 15 tiles, but if you want to even start even more simple than that, the science of behavior change would say, empower your clients to maybe only choose a couple data points to focus on. maybe 3 to 5, maybe even less. Like have your clients choose from those 10 or 15 tiles that you offer them, choose which ones are most important to them to focus on. It might be sleep. It might be steps. It might be blood glucose. It might be body composition. There's lots of options, as we already said. And so empower them to choose 3 to 5 tiles that they can track either on a daily or a weekly basis. And the reason that's important in terms of the science of behavior change and creating sustainable habits, we need to set up success and make it so it's something like a commitment and that they can get used to. And so there might be data points that make sense to track daily. There might be data points that make sense to track weekly. Whatever it is, support your patients, your clients with choosing on their own so they're empowered. Because the more they choose, the more they take action based on their own desires and motivations, the more likely they are to stick with these decisions as long-term habits. All right. Number 2, here's another pro tip. This is what I do in my coaching practice. Review your clients' data during coaching calls or during your clinic visits. Of course, the first step is getting them on the system, helping them get data sources connected, which we'll show you in a second on the demo. But once you get through that first implementation step, actually infusing this in your practice by going over the data during your calls, during your visits, and making them feel part of the process. So for instance, find things to celebrate. What data points are going well for them? And how can you celebrate those to build on your client's motivation? And number 2, you can also find things that you can maybe improve. So to maybe set a new goal. For instance, you might notice with a particular patient or client that their heart rate variability was low on a certain morning, or maybe there was a trend. Maybe weekends they had a dip in sleep data or a dip in recovery. And so you can ask your clients and patients, what do you think caused that? And you can make it an educational moment and have them reflect on their own experience. Or your blood pressure was a great score. Congrats. Keep it up. Find ways to celebrate and innovate. So finding ways to build the motivation and also find those areas to stay focused on setting a new goal. So these are examples of how you can infuse it inside of your actual visits, whether you're doing virtual calls or in-person visits, both will work. And within that, so you can actually share progress reports as well. One of our features in our report section of our demo of our platform allows you to run PDF progress reports with your clients. So you and your patients can see the trends of their data. And this is where it can really inspire behavior change, motivation, right? So they feel more part of the process. They understand like, oh, interesting. If they're able to start making connections between how their lifestyle behaviors are impacting some of their objective data points, then they're more intrigued and curious about how they can influence these, especially when the feedback loop is there to show them how the data is trending over time. So that is something I highly suggest. You can download PDF progress reports prior to visits. You can share those with your clients via email or inside of our PDF storage system inside of Heads Up. And then the final bonus tip under Secret 3, I imagine some of you have a team. It might not just be yourself. Now, some of you, it might just be you might just be a solo practitioner. But if you have other team members, it's highly encouraged to involve other team members to help manage your clients, right? Maybe you're not the right person to always be checking in on their data on a daily basis or a weekly basis. Maybe you've got an office manager or a coach or a care coordinator that it makes sense to involve in that. So it really requires you to take a step back and ask, like, how can you involve other members of your team to use Heads Up and to support your clients with their data? So that's secret number 3, infusing it into your practice. Questions. I've just gone over the top 3 secrets. John, if you have comments, we'll take those as well. But I'd love to hear from our attendees here. Let us know which of these 3 secrets resonates with you the most in terms of like, oh, that feels like it could be really valuable or really important that I want to take action on. We'd love to hear from you. Just put the number, either 1, 2, or 3 in the chat box. Again, we'd love to hear which of these 3 resonate with you the most. Angela says 3. Nikki says 3. The notion of empowering patients. Yep. Awesome. John, which of these 3 do you think are the most powerful?
I mean, I'm going to have to go with the panel and say number 3, right? So, I mean, I think you said it perfectly, where just like everything else in our world these days, we are inundated with data. And I mean, there are so many data points when you're looking specifically at health, especially with all the tracking devices that are available. It becomes almost a challenge to figure out which ones to focus on and to not overwhelm your patients, because for some of the practitioners, you're aware of all the different data points, how to interpret them. But for a lot of people who are starting off and really trying to take care of their own health and working together with a practitioner, it's overwhelming. And so it's very important to really back it up. Like you said, state what the goals are, but then also which data points are we going to look at initially to really get to those goals, and then build off of that. And that's kind of one of the benefits, is you can streamline it down to the most basic principles, the most basic data points, and then start reintroducing new data points as you go along. And I really believe that the real-time feedback that you get from a lot of these data points really differentiates you from any other practitioner out there, because a lot of people will just say, well, did you lose weight, as a metric of success.
Right.
I think if you're coming to us and interested in a platform like this, you've gone beyond that metric as your metric of success. And so I think it's a great way to infuse it into your practice, like you said, use it as a recruiting tool, as a marketing tool, because I can't tell you how many people I've shown the platform to, and that in itself is a selling point, because they're more infatuated with the actual platform than with me. And I kind of take it personally, but then I'm happy because I know it'll be successful, and it'll be a way for us to track their success.
Exactly. Yeah. And I think, like you said, most people have been agreeing that number 3 is the big one, but all 3 are important, and it really does come down to it starts with positioning. So don't forget that. Like, we want to infuse it right away, but we have to position it properly first. So moving on, I want to next address what we found at Heads Up are the 2 core problems in healthcare. Okay. And why we were ultimately founded back in 2016. So number 1, in general, we have an outdated healthcare system. Conventional medicine is not meeting the need for an increasingly large percentage of the population. And you know this, otherwise you wouldn't be here right now. So these 3 categories of patients or of individuals are really the types of people we serve on our system, and we support them with creating better health overall. So whether it's chronic illness, professional athletes, or everywhere in between, the proactive healthy, there's a big opportunity for you to tailor your approach, right? I asked earlier what your target market was in your practice. So our system is highly customizable and intended to help support these categories of individuals with creating better health. Problem number 2 is how fragmented the health data really is in our world. Let's be real. We've got hundreds and thousands of apps and devices and wearables and you name it. So these 5 categories of companies, device companies, testing companies, operating systems, patient portals, et cetera, really show how fragmented the data really is, right? So our intention from day 1 has actually been to solve for this. And so we actually integrate and bring in data from most of these logos that you see right here on this slide. And so we help you organize the data, and then we add analytics tools to make meaning of the data. And then at the end of the day, it's all about personalizing those outcomes. So once you've organized and analyzed the data, how can you use the data to increase better outcomes, data-driven outcomes? That's what we're about, personalized solutions. So I'm going to share our simple formula with you in a second, but first, a couple of success stories. So to give you an idea, these are a couple practices that are currently using our system and really loving it. So Megan Ramos, co-founder of the fasting method, You all might know of the fasting method, co-founder with Dr. Jason Fung, New York Times bestselling author. So Megan says, it's just really easy to use. You don't have to be a tech wizard to navigate your platform. Anyone can navigate the platform. And we capture everything that people need to modify behavior and make sustainable change. So that's why the fasting method decided to roll out our system as an add-on, as a benefit to their overall membership. So we love working with the fasting method. They're a great client of ours, as is another success story, Dr. Kevin Sprouse. This is a sports medicine head physician at Podium Sports Medicine. And so a great success story here. He works with professional athletes, mostly some executives. And so he's talking about the challenge of looking at all the data from various sources, Oura Ring, glucose monitors, scales, blood pressure cuffs, you name it. Typically, most people look at these data points in isolation. Even if you try to combine them, looking at them together, it's pulling up two screens at the same time. Perhaps some of you can relate to this. With Heads Up, we bring in all the data in one place, and then you can customize what reports you run to analyze and overlay whatever you want. And so that was a big value add for Kevin and why he decided to go all in with Heads Up. So now let us share the ultimate formula you can use to overcome maybe the challenges that you have related to data fragmentation in your practice. Okay, so we call this the OAO formula. This is the formula before Heads Up. So organize. Step one, organizing the data. Before Heads Up, as John talked about, you've got spreadsheets, maybe you've got PDFs, emails from clients, text messages, screenshots from apps, Facebook messages, patient portals, laptop, EMRs, the list goes on. And maybe those are in Google Drive or Dropbox or inside the EMR. Either way, it's either not in a patient-friendly environment or not in a HIPAA-compliant, safe environment. So that's organized before Heads Up. Analyze, pulling up multiple windows at once, maybe using Google Sheets again, and optimize. The typical way that clinicians and coaches make suggestions and provide guidance on improving both lifestyle and clinical data, really it comes down to waiting until the next visit and not having a way to remotely see this data in between visits, right? So continuous care going remote, you're able to remotely monitor the data now with Heads Up. And so the OAO formula with Heads Up, organize, you pull in all the data into one place, wearables, devices, apps, medical records, patient portals, lab testing companies. Step two, analyzing that data. You can run progress reports right inside of our app to see how your clients are trending over time. And of course, optimize. So having a clear picture of your client's data and their full health status allows you to provide targeted, personalized solutions for data-driven results. So that's how you can use this system. Again, organize, analyze, and optimize is the three-step formula you can deploy when using Heads Up. All right, so now I want to pause. We're 40 minutes in and want to take some questions, and I also want to transition into a demo to start showing a brief idea of what the system looks like. But before I do, I'm going to put a link in the chat box. I'm not sure if everyone already has an account with us, but we can give you access to an account. I'm going to put a link in the chat box. So there's a link in the chat box. Go ahead and click that link if you do not already have a pro account. Okay, so on this page, as you see here, when you click the link, and go ahead and click it even if you can't access or work on it right now, but click it so you can save it, maybe do it after the webinar or do it right now. It's really easy. You just fill out a couple questions about your practice, your name, email, and password, and then that's a cue for us on our end. We'll go ahead and accept your account to your trial. Nikki asks if I can send the link to the drop down to all panelists and attendees. I put it to all panelists, but if you want to do something else, by all means, Nikki, feel free. So that's step one. Go ahead and request an account if you don't already have one with us. All right. Now, step two, I'll give you a quick little tour of the system. All right. So the first thing to share, Martha says she doesn't Oh, I send it to all panelists. Oops, not to all.
All
Thank
attendees.
you. Yeah. So I just put it in there again. So I just put the link back in again. Now all attendees should see it. So the first thing that you see when logging in is our lifestyle dashboard. This is where individuals log in first, either on the mobile app or the desktop app. And again, we have over 60 different data points. So we help you choose the top 15 or 20 that you want to roll out in your practice. You know, maybe it's vital signs like body temperature, blood pressure, or maybe it's recovery data, sleep, movement, blood glucose, meditation time, blood oxygen. We have a fasting timer, ketones, measurements, macronutrient data, lots of options, as you can see. Okay. And now let me show you our integration partners. This is an update for a lot of y'all. All right. So devices and apps, you go up to connect data, devices and apps. These are our 18 different lifestyle integration partners. This is the power of remote lifestyle data in action. I don't know of any other platform that has as many integration partners as we do. John, perhaps you know of some, but I think we're pretty on the bleeding edge here. So quick review of these. So Apple Health, we pull all data from Apple Health Kit. And as you may have seen today, they're launching a new software and a new device, which is pretty exciting. The Oura Ring, a really advanced wearable worn on the finger for sleep and recovery data. We are in beta right now with continuous glucose monitoring, Dexcom and Libre. Fitbit, MyFitnessPal, Withings, Garmin, some mainstream ones. Keto Mojo for blood glucose and ketone monitoring, BioStrap, BioSense, and then some macronutrient data from Chronometer and My Macros, as well as Elite HRV for heart rate variability, training, and recovery. So those are our lifestyle integration partners. All right. And I won't do a full demo here. I'm just going to give you a taste, but I also want to share our lab results section. So the value of our system actually is that you're able to run reports to analyze and correlate lifestyle data with clinical data. And we have integrations to pull in data automatically from medical records. We have integrations with 85% of the United States patient portals, as well as several different lab testing companies, including Quest, LabCorp, a new offering by LabCorp called Pixel, Everlywell, and PWN Health. So these are direct integrations where your clients or you can go in and log in to pull in the medical record data straight into our system directly from these lab testing companies. So the lab results section is an area where you can add in the clinical data and then running reports. This is what I mentioned earlier, a way to infuse this into your practice. So to be able to run reports on your clients and see how their data is trending over time, you can plot up to 6 different data points all at the same time, export the data as a CSV or a PDF, and you can start to review the data on calls or during visits with clients. So my internet's loading here, but the reports section, there it is. So this gives you an idea. It's a graph for showing the data, and you can customize the time period. I have some data points that I've selected from the Oura Ring. So heart rate variability, meditation time, deep sleep, alcohol intake, and resting heart rate. So what you can do is you can choose the time period that you analyze the data for, and we'll automatically compare whatever time period you select to the previous time period, showing you down below where your client's data is trending over time. Now, I hereby release you of all my personal health information, my PHI. This is my recovery data, for instance. My heart rate variability is trending up 4%, which is positive from this period. Resting heart rate's pretty flat. Deep sleep is down 8%. So something might be affecting that inside of this period here. And so you can review this data and with your clients on visits. And like I said, celebrate the successes of high amounts of deep sleep, or ask them, oh, what happened on these days where your heart rate variability was a lot lower? Whatever data point you're tracking in our system, lifestyle or clinical, you can pull it in to the reports feature and run progress reports. You can export this, as I mentioned earlier, as a CSV, a PDF, or a PNG file. So that is the consumer-facing app. And then we have a whole pro area where you can actually remotely monitor. We call it our Smart Rows feature, where you can remotely monitor all of your clients' data all in the same place. So that is a pretty popular feature on the pro side of things. But that is a quick little taste of the demo for everyone. And to continue on, I'll now invite questions before I give an overview of the opportunity, the last chance to get involved with us here in the Founders Club. Questions, comments below, go ahead and use the chat box, or John, if you want to make any comments.
Yeah, I think that was a great presentation, so thank you for that. The only thing else that I would add, and I think it's extremely important, is accountability. This platform allows both you and your patients to be held accountable. And I think one of the hardest things with us going online and virtual is it becomes a lot harder to really keep your patients accountable and them to keep you accountable. And so when you have the data staring you in the face, it's really hard to get away from that. And because all this data is HIPAA compliant, you don't have to worry about any legal issues. So I find it's been very, very beneficial to make sure that we're both on this, my patient and I are both on the same page as far as what our goals are, and that we're both performing the way that we should be.
That's such a good point. It's both ways. Yeah, it's the accountability for the practice, right? And the consumer, the individual, the patient, the client, because this is new for all of us. To some extent, going fully remote. And that's not to say everyone's fully remote. If you're still on with us right now, I do have a quick question. Please put in the chat box. Let us know. Are you mostly remote? Are you mostly in person? Or are you all of one? Let us know. Let us know if you run a remote practice or in person or a hybrid of the two. Just put that in the chat box.
Yeah, even if you're in person, I mean, just visually, when your client comes in and you can present the data the way it is, I think that is aesthetically pleasing and it looks professional. It really makes you look like you're on top of what you're doing.
That's a great point. Yeah, I know a lot of our clients or practices are doing that right now. So, all right, so we got 10 minutes left. I'm going to go ahead and dive right into the Founders Club, everything that's included in our early adopter pricing. We have different packages based on how many clients or patients you have. Again, this is last chance to get involved in our early adopter community. Looks like Martha says she's a hybrid practice. Awesome. So moving on. So the Founders Club. All right. Everything that's included. So we have a couple different levels. Our top level gets you up to 50 clients. That's a $450 value. Access to all your clients' data, the secure file storage, which we have in there to store PDFs, JPEGs, and video files. The reports feature, the analyzer to see trends over time. The customized dashboard. We will actually customize your lifestyle dashboard, whatever the data you want them to track. Next, our monthly mastermind that I mentioned earlier, the fourth Wednesday of each month. Dr. Lemansky and I and our team co-lead this webinar, this mastermind, I should say. It's a really tight-knit, private community of data-driven health professionals. And it's a chance to stay on the cutting edge and explore new topics, new data points, and ways to improve your practice. And we also have bulk client and bulk biomarker imports. So total value is about $1,000 a month. But the early adopter rate, when you join with us, we have 3 different levels available. Again, this is just general membership. We have white label available as well, which are higher levels that you can get your custom branding in. But these are non-white label levels, and they start at $29 a month. We have $49 and then $99. And the opportunity to get involved with us only in September only. We're going to be closing the Founders Club at the end of September. Is to get your first month completely free. So if you're interested in trying out our system, if you want to give this a shot, you got nothing to lose. You just use this code. Once you have your account created, there'll be an upgrade button inside of your pro portal. You click that and you fill in your credit card information and you use this code right here. We'll put this code in the chat box as well. So you all have it. It's last chance 100. Again, this is limited to the next 20 people that sign up for this, and we might have another webinar. This might be the last one that we have to promote this. And here are a couple bonuses that come with your membership. Number one, as soon as you upgrade using that coupon code inside the app, you're going to get an email for an onboarding call. So we're going to do an onboarding call to review your goals and to customize the portal to your liking. And we'll give you tips for how to roll this out. Bonus number 2, our private, intimate Facebook group for Founders Club members only. Bonus number 3, this is a new one. We're now starting to hold weekly office hours. So we're going to have an office hour and Q&A session where both myself and another member of our team, Chuck, will be on to help answer any questions and support you with understanding our system, how to roll this out, how to position it, and how to properly use it in your practice. So it's helping you grow your practice and it's helping you improve outcomes. So total value for these bonuses, another $900. So about $2,000 total value per month. But the early adopter rate, again, only available this month is one of these 3 levels, $29, $49, or $99. So a couple other features to announce. These are also bonuses. These are some new features that will be coming out. And some of these new features, we're not going to actually charge you extra. So because of you would be a part of our early adopter community, you can help us influence what we build next. So our current 75 members in our Founders Club have helped influence what we build next. And these new features, for instance, notes and protocols. We're launching a feature to be able to create notes in our system and create protocols from scratch, sending those to your clients. Those are going to be included. That'll roll out sometime in October, no extra cost. Food journaling, a new feature will roll out in November or December of this year, no extra cost. Alerts and notifications, that'll roll out sometime in 2021 for both you and your patients to get alerts and notifications when you're out of range for certain data points, maybe some important vital signs. That will come out in 2021, no extra cost. And again, you can help us influence what features we work on next, what we build and roll out next. We want to hear from you. All of our members get a vote. You get a chance to let your voice be heard in terms of priority for what we build next. So that is an overview of some exciting new features we have coming out very soon. And again, your next steps, if you haven't already, is follow the link in the chat box to complete your account request. That will get you a pro account, and we'll approve that on our end. So we are in beta, so we're accepting and vetting everyone out. So I will accept you on our end once you request that account. And then once you upgrade inside the app, you can schedule an onboarding call with me directly. And I'll go ahead and put this link in the chat box as well. And yeah, so it really comes down to asking the question, what plan should you select? What works best for you? And so my question for everyone on the call right now, I know some people are starting their practice and other people have their practices already humming. So out of these levels, basically, how many clients do you have? Where do you want to start with us? So $29 a month, that gets you up to 5 clients. $49 a month gets you up to 10 clients with us. And $99 a month gets you up to 25 clients. So as you can see, as you grow with us, the per client per month rate goes down. And the pricing on these levels is never going to be as low as it is now. So you can lock in these rates for at least a year. Again, these are non-white label rates. So if you are interested in white label, if you're interested in some custom branding into your portal and some other custom features, please do reach out. We'd love to hear from you. You can reach out directly at my email. It's tj@headsuphealth.com. I'll put that in the chat box as well. That rounds out today's presentation with 4 minutes to spare. We can take some Q&A and help everyone get started here. There are some questions here. Anne Marie says she couldn't access the link, but she filled it out on her iPhone. Awesome. Cool. So again, your next step is to fill out the request for your account at this link here, and then schedule your onboarding with us after you choose which account works for you. Again, your first month is $0. So if you join sometime in September, your first month using Last Chance 100 is $0. So you wouldn't be charged until sometime in October, a month after you use the coupon code at whatever level you start with, 29, 49, or 99. John, any last parting words or comments on this?
You made me want to sign up. So. No, I mean, I think the value is understated to be honest with you. I think just in terms of time saved, it's priceless. And I think one of the really important points of Heads Up Health is, as TJ mentioned, is we value the feedback that we get from our customer base in order to make the product better, because we approach it from one perspective, but everybody has certain topics that they want us to address, or certain kind of changes, tweaks that they want, and so the product really is built around our user base. So I think it's a great product.
Yeah, that's a great point. The saved time is priceless, right? Like, nothing is worse than having your time be gobbled up by the wrong projects, and you can't work on the things that you need to be able to grow your practice and invest in creating new programs and better offerings. So that's a big goal of ours, is to help you save boatloads of time.
And especially for the practitioners who are starting their practices, I mean, that's going to be the biggest barrier, I think, beyond just trying to get new clients, is time management and being able to have a platform where you can have all the data in one spot. So definitely something to look into.
Exactly. Yep. And here's the thing, once you do join and take us up on this free month, again, there's no long-term contracts. I want to hit this point home. We have no long-term contracts unless you're a white label account with us. So it's month to month. And we want you to be successful with it. And so you can actually post questions that you have inside of our Facebook group. So I'll go ahead and put that link in the chat box as well for you all if you want to request access to this private Facebook group. We've got about 80 members in there right now. Again, once we hit 100, we are closing this, which will happen in the next couple of weeks. It could happen soon. So awesome. The requests are coming in. I'm accepting them as fast as I can. So once you get in there, again, you're going to navigate to your pro account, and you're going to select, there'll be an upgrade button at the top of the pro account. That's where you're going to use that coupon code Last Chance 100. You're welcome, Angela. You're welcome, Martha and Anne Marie, and everyone who's already requested an account and planning to upgrade. We're excited to hear how you want to best use this. We'll get your onboarding call scheduled. We'll help you customize your portal and support you on rolling this out so it can be as seamless and impactful as possible. Cool. Well, without further ado, I'm going to go ahead and close down today's training session. And again, here is where you can go to take action. Follow this link. Use the code Last Chance 100. Again, your first month is free. And then you can choose what plan works best for you inside of our app. All are available to upgrade on. Cool. Thanks for being with us today, John.
Yeah, it was my pleasure. Great talking to you, and hope everybody joins and enjoys the platform.
Yeah, we're excited to see you guys on our monthly mastermind. It's the fourth Wednesday of each month. That's where you'll see John and I again, our private Facebook group, and we're here to help answer any questions. So you can post those in the Facebook group or via email. You can reach out directly to me, TJ@headsuphealth.com. Awesome.
Alrighty.
We'll see you all on the inside.